Governor, guy from the White House, Botticelli. I'm not quite sure who all.
So it's our local.
Yeah, some of the local guys, and then the guy from the White House leading it, Botticelli.
And are they speaking to us or are we speaking to them?
I think it's kind of a panel discussion, so I think they'll have a lead-in and then there'll be a dialogue. Okay. All right, let's get started, please. Good afternoon. This is a rowdy audience, rowdier than the group of students. Could everyone please get seated? Thank you. What's that?
Statewide news service. Where do I put my microphone? Is there a
Ask this guy. The first guy. No, the guy, the short guy right there.
The guy?
Yeah. Welcome, everyone. I'd like to welcome you to this White House Community Forum on the opioid epidemic. My name is Greg Dewey, and I am the president of Albany College of Pharmacy and Health Sciences. Our college is very proud to have the opportunity to host this event. It is entirely appropriate that this dialogue occur at a college of pharmacy. The opioid epidemic has reached alarming proportions, and the entire healthcare community must address opioid abuse with some urgency. We see the pharmacist as a key player. Earlier today, Senator Tonko talked about resources and policy. We here at the pharmacy school believe that pharmacist is a great untapped resource. Nobody knows medication like a pharmacist. Nobody knows the effect of drug action, the side effects, the importance of dosage, like a pharmacist. But the pharmacist cannot fully use his or her education and training without the right policy. So resources and policy will go hand in hand in the pharmacist's role as a key untapped player in attacking the opioid epidemic. The College of Pharmacy has been engaged with this issue for some time. It's been teaching our students about it. It's been teaching the local community about the epidemic. We have joined more than 60 other pharmacy schools in a pledge to build training into our curriculum on how to save lives with overdose interventions and the proper counseling of individuals with overdose from opioid use. We educate our students for an expanded role as pharmacists. They know medication therapy management. They are positioned to play a key role in this battle, educating patients, families, and in some cases prescribers on how these drugs work and the potential risks of addiction. There are a number of efforts pharmacists are already engaged in. Prescription drug monitoring programs are used to ensure prescriptions are valid, thereby discouraging the practice of doctor shopping. Many pharmacists have been involved and have spearheaded medication take-back programs, which have kept unused or expired medications out of the hands of those who might abuse them. Legislation recently was passed in the state of Vermont giving pharmacists provider status to attack the opioid epidemic. This lobbying effort was aided by our students at our Colchester campus. This legislation allows pharmacists to bill for counseling, education, and treatment of opioid use. By gaining provider status, pharmacists can expand their fight against the opioid epidemics. It is our hope that we will continue to see broader support for such measures because it will take the knowledge and action of all healthcare providers to bring opioid abuse under control and stop the epidemic. So we welcome this conversation. It's a multidimensional problem, and we look forward to what our panelists have to say. It is now my pleasure to welcome Lieutenant Governor Kathy Hochul, Commissioner of the New York State Office of Alcoholism and Substance Abuse Services.
Thank you, Dr. Dewey, and thank you for hosting us here today for this critically important conversation. We are assembling the best and the brightest in not just the state of New York, but in our nation to come here and talk about strategies to finally get our arms around and address and hopefully solve the epidemic of heroin and opiate addiction. And that's a big statement because people say, well, how do you solve something this complicated? Well, let me tell you where we're heading with this under the direction of Governor Andrew Cuomo. But first, by way of background, I am Lieutenant Governor, but in a previous incarnation, a generation ago, I was a staffer to Senator Daniel Patrick Moynihan. My first week on the job in August of 1986, the senator tasked me with participating in an effort to come up with a solution to the then crack cocaine crisis, which was killing people and taking down prominent individuals like Len Bias, who was a well-known athlete. And there was a lot of public attention on this, and there was a political will at the time in the Democratic House and the Republican Senate to say, yes, this is something we'll work on together. And so for 2 solid months, we worked together and carved out what was a compromise, and truly, with its focus on prevention, treatment, law enforcement, interdiction, and a price tag of $1.6 billion, billion with a B, we were able to get it through the Congress. Fast forward to today, a situation which I would say far exceeds the scope of what that crisis was in 1986. More people are dying, more people affected, more people are needing long-term recovery, and we once again look to our leaders in Congress and in Washington for a solution. The difference today, They talk a good line. They pass legislation. They take the low-hanging fruit. They think they're solving it. They can put out the press release that we're taking care of this situation. But I'm going to tell you, where's the money? Because if they address this the same way that our nation did in 1986 when we allocated $1.6 billion, we'd be looking at, in today's dollars, $3.6 billion. So our president is simply trying to get through an initial pass of $1.1 billion, and he is being stymied every inch of the way. Ladies and gentlemen, that is unacceptable. In fact, that is unconscionable. For me to have to go back to the moms and dads, thank you. For me to go back to the family members who are in searing pain over the loss of their child. Because in life, a parent's not supposed to bury a child. It's supposed to be the other way around. But we are in a unique, surreal circumstance that demands a heightened response, and that is exactly what we're about to talk about. And I want to say how proud I am to be in a state where we have a governor who not just woke up to this issue this year, but years ago in 2014 put together a comprehensive package which finally got us eye-stopped so we could address the overprescribing but also the doctor shopping, which led to so many people getting these pills in their hands. And that is what is so unique about this crisis. We were just asked, what's the difference between this crisis today and the heroin addiction of the 60s and 70s or the crack cocaine of the 80s and 90s? Ladies and gentlemen, 80% of today's people who are addicted started on a legally prescribed prescription given by a trustworthy individual, their own doctor. That is the difference today. Now, these doctors were told by pharmaceuticals that these drugs can alleviate pain. That is a statement of fact. Yes, you are out of pain. In fact, you're downright euphoric. But is that necessary to address the same kind of pain that a generation earlier dealt with it differently and, in fact, are not addicted? Case in point, my children, high school students a long time ago, both get their wisdom teeth out within a year of each other. Dentist gives them a 30-day supply of hydrocodone. Now, luckily, I was an elected official. I knew law enforcement. I knew enough to say, don't touch that, kids. You're going to suffer for a couple days. Here's a Tylenol. They didn't appreciate that at the time. I think today they do. But sadly, when I go to hearings around the state and I look into the eyes of moms and dads, there's tremendous guilt because their child, they didn't know any better. They were listening to a doctor or a dentist and taking that drug that led to an addiction, which then led to heroin, which led to their death. And that is the exact connection that we can make today. And that is why the governor assembled a task force of experts, and I'm so proud that I was joined in this endeavor by our OASIS Commissioner, Arlene Gonzalez-Sanchez, who you're going to be hearing from shortly. She brought the weight of her office, her years of experience, and the support that she has from the recovery community to go with me on behalf of our governor, with people of our task force assembled from all walks of life, people in recovery themselves, people in law enforcement, people in the prevention and treatment services. We brought together the elite best of the best to do this. We have traveled the state of New York. We have been everywhere from Brooklyn yesterday morning to Lake Placid a couple days ago to Buffalo, Central New York, Long Island, Staten Island, you name it, we are there. And what we're hearing are not just the unique problems of the individual parts of the state. For example, in the North Country, you may have to travel 100 miles to go to a methadone clinic. You need this every day. Who can do that? Whereas in a city, there's too many people. The wait lists are too long in an urban area. So representing the state of New York, we realize we might need a different approach to this. But the common theme was we've got to increase doctor education. We have to make sure that the prescribers are aware of the impact, and I believe we're making a difference. I believe the medical community realizes this, that they're inadvertently part of this problem, which they want to help solve. That is progress. The insurance companies play a role, because how many people came and testified before us and said, my child was ready to get help, but they are turned away because of bureaucratic stoppages in the system that required pre-approvals, and you needed to be practically dying in order to be able to go into detox. And as a result, their child went out there, and that was the last time they ever walked on this earth. That's what we're hearing. We need the pharmaceuticals, the doctors, the insurance company, and also financial support for our recovery service community dramatically. That includes beds, that includes more assistance, that includes longer care. But You're going to hear more about this when we release our report to the governor, which is going on as we speak, and we anticipate at the end of this session, which is June 16th, it's closing in, we will have a package that has gone before our Assembly and our Senate, and we're going to get it passed. I'm sure as I'm standing here, we're going to make that happen. But I want to just give a couple, in my final minute here, a couple of recommendations at the federal level, because so many times we're out there listening to witnesses who say, if only we can get the federal government to change, and that's what exactly our director, Botticelli, has asked for us. For example, there are limits on how much a doctor can prescribe, not on the front end when the problem's being created, but on the recovery side. This does not make sense, ladies and gentlemen, that a nurse practitioner, a physician's assistant is able to prescribe an opiate, but is not able to legally prescribe the antidote to that or the solution. That can be fixed at the federal level. Remove the cap. Why limit a doctor to be able to have 100 patients? We need 200, 300. There are just not enough doctors in the recovery addiction services. We need to deal with that. How many days a doctor can prescribe for? The partial fill initiative that's talked about in Congress now is something we would support. So there's a lot of ways to deal with this. I could go on forever, as you can tell. I'm very passionate about this. But one thing I want to stop doing is going to funerals. And I was shocked to just see a report in the Buffalo News as I was coming here today that we are applauding ourselves in Erie County, population about 900,000, that we no longer are losing 10 people a week. We've reduced it to 9. So we're supposed to celebrate that I'll be going to 9 funerals instead of 10. Now, right direction, but look at the scale of that problem. Erie County, Buffalo, New York is on this path track right now to lose 500 people this year. We're already at 248. I don't want to do this anymore. I want to be done. I want to talk about something else. But I believe the political will from the people you're going to hear from, all of us band together to support Governor Cuomo, but also making sure our voices are heard in Washington, where the big solution come and the state can benefit from that dramatically, is so desperately needed. Thank you very much.
Thank you, Lieutenant Governor Hochul, and good afternoon, everyone. I want to begin by expressing how content I am to have Director Botticelli, who's an old friend of mine, here today in this such an important event. And I know you will hear from him shortly, but publicly I wanted to address how thrilled I am that he is here in Albany. I want to also acknowledge and thank Congressman Paul Tonko, who has been a real strong supporter of OASIS and who's also hosting this event here today, together with Congressman Chris Gibson and the U.S. Attorney Richard Hartunian, and of course our panelists that you will hear from. You know, as commissioner of the largest addiction treatment, prevention, and recovery system in the nation, with 1,500 providers serving approximately 100,000 individuals on any one day, I can attest to the enormity of this heroin and opioid epidemic. Similar to other states, opioid addiction and overdose deaths continue to plague families in communities across our state. Heroin and opioid overdose-related deaths has actually increased from 2010 to the present by 47%. So the problem doesn't seem to be going away, but neither are we. Under Governor Cuomo's leadership, we have implemented several reforms to combat this heroin and opioid epidemic. We've increased access to all types of addiction treatment across our continuum of care, including inpatient, outpatient, and residential settings, expanded medicated-assisted treatment services. In fact, through our aggressive efforts, we've added nearly 2,000 opioid treatment beds overall in these past 2 years into our system. We've trained more than 112,000 individuals to use the life-saving opioid reversal drug naloxone, and as a result, more than 3,500 overdoses have been reversed. and more than 1,500 lives have been saved. And I must say that number continues to grow as we speak. We've also implemented a new on-call peer program in emergency departments to help connect individuals to substance use disorder treatment after an opioid overdose reversal or any other addicted-related crisis. We are excited about this new effort because it is our expectation that these peers will be that warm hand that some of these individuals need in order to accept treatment and begin a life in recovery, and not just be reversed and sent on their own merry way without that additional support. We have also launched a new Family Support Navigator program to provide guidance and support to families who are in need of assistance in navigating services for their loved ones. We've also developed a treatment availability dashboard available on our website, which enables anyone to find available treatment beds in the state in real time. We're planning on expanding this dashboard to include all of our services. We've required the use of our own level of care tool that we call the Locator 3 tool that we have developed so that insurers, providers, and families are all using the same criteria for levels of treatment. And we've ensured that this tool does not include failing first at outpatient treatment in order for inpatient care to be covered. We've expanded recovery and peer support services, including expanding recovery centers in the community. And through our residential redesign efforts, rehabilitative addictive services are now possible in both outpatient and residential settings. Providers are able to treat patients in the community and outside the four walls of the clinic. And to improve recovery services for young people, we recently created 7 adolescent clubhouses throughout the state. This is a first-of-its-kind model that will promote peer-driven supports and services in a non-clinical setting for young New Yorkers in recovery or who are at risk for substance use disorders. We've raised awareness regarding the stigma of addiction and the dangers of opioids and other drugs through our public education campaigns. So while we have done a lot, there is still more to be done, but we cannot do it alone. That's why we are so pleased that we have some of our federal partners here today. They understand the magnitude of the epidemic and that additional funding is needed to make treatment, prevention, and recovery expansions a reality. We also need to support our federal partners in their efforts to obtain more funding. So President Obama has called on Congress to pass a $1.1 billion in new funding to make sure that everyone with an addiction problem who needs treatment can get the help that they need in real time. That is why President Obama's $1.1 billion plan is so needed and is so timely. We need to garner support for this plan to pass so that we can build and expand on what we have developed and end this epidemic. In closing, I want to sincerely thank all of you here today for being a part of the solution. Every time we talk about these important issues, we have the opportunity to save a life. We have the opportunity to connect people to addiction treatment so that they can join the 23 million Americans living in recovery. Thank you for your time and attention today, but more importantly, thank you for your ongoing support in this matter. And so now, it is my pleasure to introduce the next speaker, who is the U.S. Attorney Richard Harturian.
Good afternoon, everyone. It's a pleasure to be with you here today, although we're talking about a difficult subject, and I want to thank Director Botticelli and all of our state and local elected officials and leaders, and we have many in the crowd here, I see, and welcome to all of you to have an important discussion about opioid abuse. I am the United States Attorney for the Northern District of New York. That's an area that encompasses 32 counties, most of upstate, about 30,000 square miles. And I have to tell you that this crisis reaches every corner of our district and is something that is ravaging families, including many law enforcement families, and one of great magnitude and severity. So much so that I tell you it has the attention not only of the President, but of Attorney General Loretta Lynch and her advisory committee, which I serve as vice chairman of, and all 92 of my U.S. attorney colleagues across the country from coast to coast. This is something we talk about whenever we get together, one of our really important and difficult challenges in law enforcement. So our role as U.S. attorneys is primarily one of chief law enforcement officers, working with our federal agencies and our state and local counterparts to enforce the law. And what that means, essentially, is that we're the ones who are called upon to aggressively prosecute drug trafficking organizations and heroin dealers, especially those whose poison kills, as we have done recently in a case in Syracuse, which resulted in the death of a 24-year-old woman who was 5 months pregnant. We prosecute pill mills and rogue internet pharmacies and illicit pain clinics, and the occasional medical professional who puts personal profit before patient care, as we did recently in a case involving Dr. Jeffrey Gundel, who was an orthopedic surgeon from Gansevoort, who was sentenced in January to a lengthy term of imprisonment for distributing 60,000 oxycodone pills that were sold on the black market in return for cash kickbacks having nothing to do with legitimate patient care. We use, in addition to the criminal remedies that are at our disposal, we use civil penalties as well when that is an appropriate sanction. And we have brought cases against pharmacies and healthcare providers whose lapse in judgment is appropriate for civil penalties when prescription drugs have been diverted. And we do this all with the idea that we want to deter this conduct. We want to stop the supply of heroin and other dangerous drugs that are coming into the country and into our district. We want to deter people, and we want to get the word out about the severe harm that this scourge is causing. So that is our primary function for certain. But in addition to that, we in law enforcement understand that we have another role to play in a comprehensive solution to the problem. And that role is one of being involved in education and prevention. It is a holistic approach that I think is required here. And I have to tell you that my law enforcement colleagues, since the time I started in law enforcement, have come a long way. And I've been involved for more than 2.5 decades in this business. But we've come a long way in understanding that we have to really approach this problem comprehensively. So we do that by educating parents, youth, patients on the dangers of illicit drugs and the misuse of prescription drugs, by supporting physician education on the prescription of opioids and the need for careful attention and active management to preserve their availability, to relieve suffering and diminish the abuse of opioids, and of course by supporting increasing the availability and accessibility of treatment, which I know is a major problem. So with these goals in mind, really, my office, since I took over in 2010 and even before that, has been at the forefront of efforts to bring together leaders in public health and law enforcement and the pharmaceutical and healthcare industries and the educational providers as well, to develop strategies to address the problem. We have convened a prescription drug summit back in 2011 where we had 200 or 300 people talk about this problem and formulate strategies that we could utilize in addition to strong enforcement strategies, prevention and treatment strategies as well, which we have rolled out. We've conducted town hall meetings, a webinar. We've reached out to treatment providers. We've supported DEA's drug take-back program, which of course has been wildly successful in removing pills that are laying around in people's medicine cabinets there to be taken and abused. And we've supported those efforts as well. We have, in addition, been involved heavily in training young people. We send our staff out, my AUSAs, my support staff, and other law enforcement providers, law enforcement professionals who volunteer their time to teach fifth grade students in the Capital District through our leadership project about how to avoid gang violence and drug abuse and all the problems that they're going to be facing as they enter middle school and beyond. And of course, in addition to all that, we support reentry efforts. Our intensive reentry courts operate in Syracuse and in Albany. And the goal there is to try and break the cycle of violence, the cycle of recidivism that we see happen so often, and to get people the substance abuse treatment they need, to get them the help they need so that they can reenter society successfully. We don't want to see them again. We want them to become productive members of society. So all of those things, I think, are part of, as I said, this holistic approach. We have met with families too often and been just really horribly upset at hearing the tragedies that they are facing, the heartbreak that they face based upon the victimization of dealers, their inability to get treatment and the like. So these are really terrible challenges that, as I said, are very, very important to us. We're committed to helping to solve this problem by emphasizing the importance of education and prevention and intervention, treatment and recovery, and by, of course, doing our part to reduce the supply of illicit drugs by aggressively enforcing the law and holding those accountable who prey on substance abuse disorders. So I want to thank you very much for taking the time to attend and for giving me the opportunity to talk a little bit about our role in law enforcement, and I wish you all the very best. Thank you. It is now my pleasure to introduce to you Director Frances Harding of the Substance Abuse and Mental Health Services Administration.
Good afternoon. At the Substance Abuse Services Administration, I saw someone in the audience I didn't expect. I am the Director for Substance Abuse Prevention. So it's in our area of scope of control that we look at the heroin and prescription drug issue with great concern. The United States, as you have heard, is in the grip of a national crisis. While misuse of prescription drugs is trending down, heroin is increasing as well as opiate overdose, which is increasing at an alarming rate. The President's budget announced in February 2016 supports SAMHSA's programming that targets prescription drug misuse and heroin use. I'm sure Director Botticelli will be discussing the specifics, but I would like to take you a moment to go through some of the areas of programming that will directly relate for SAMHSA so that we can bring this money to you. There are people out there in the country and in New York State who need treatment for opiate addiction and can't get it. We must act quickly to provide the resources so that everyone who seeks help can find it and find the path to a life of recovery. The President's proposed in 2017 $1.1 billion in new funding to address the prescription opiate misuse and heroin use crisis. This includes $920 million to support cooperative agreements with states to expand access to medication-assisted treatment for opiate use and overdose. States will receive funds based on the severity of the epidemic and the strength of their strategy to respond to it. States can use these funds to expand treatment capacity and make services more affordable. We are giving states the most flexibility that we are able to. The President's budget also included resources for the National Health Services Corporation funding to expand access to substance use treatment providers. and resources to evaluate the effectiveness of treatment programs employing medicated-assisted treatment and help identify opportunities to improve treatment and patients with opiate use disorders. The President's proposal also continues to build on current efforts across the Departments of Justice and Health and Human Services to expand state-level prescription drug overdose prevention strategies, to increase the availability of medicated-assisted treatment programs across the country, to improve access to the overdose reversal drug naloxone. Partnerships with ONDCP on substance use disorders will continue to collaborate with SAMHSA. Many of you may know that the Office of National Drug Control Policy funds over 600 community-based prevention organizations. SAMHSA's role in this and their partnership is we manage these. Hundreds of these coalitions have specifically focused on prescription drug misuse in their areas of most need. We also, in this budget, are able to fund community-based and programs for prevention in rural communities where the crisis is not always seen and noticed right away. All of this ties to the support SAMHSA's mission has to reduce the impact of substance use and mental illness on America's communities. We want to reduce the impact of the opiate crisis and to reduce the impact of heroin overdose. We believe at SAMHSA that behavioral health is essential to health. Prevention definitely works. Treatment is truly effective, and recovery is the state of where we want all our individuals that are seeking help for an addiction to achieve. So that's what's going on from a federal perspective in one specific agency. Now it's my honor and pleasure to introduce to you Congressman Chris Gibson, who is our next speaker. Thank you.
Well, good afternoon, everyone, and thank you for being here. You know, I know that by self-selecting to be here today, you already are keenly aware of what we're dealing with here. I know I'm talking to a room of professionals that deal with this on a daily basis, opiates, heroin, a terrible scourge that's impacting certainly in every corner of my district and really throughout the country. And, you know, I would just want to appreciate Michael Botticelli for being here today, a Siena grad. And, you know, I was one of the members, a bipartisan letter from New York. We reached out to the president and asked for their help to bring their resources up here so we could have this kind of conference. So I thank the president, and I also appreciate Michael for being here today. And, you know, I've written on this. If anyone gets my newsletters, you know, a couple different times, and, you know, our office, we can get you on that newsletter list if you're interested. But I'm going to summarize the three different areas that we have seen and been heavily involved in this space for the last several years. First is prevention and education. And I know that we have folks in the room here that are heavily involved in that. And, you know, look, so much has been done, but more needs to be done. I'm 52 years old, never used drugs, but I had some friends who did. But they never used opiates and heroin. And, you know, this is very serious. We have young folks that are experimenting in this direction, and they don't realize what is at stake, that essentially it causes a brain injury. And, you know, they end up hooked, and they're looking at inpatient. Hopefully we can get them in a really good program, and then they're looking at outpatient for 6 to 9 months, and then 12-step for the rest of their lives. It's very serious. And so prevention, ultimately, in the end, education and prevention is the most important going forward, that we can convince as many people as possible to stay away. You know, enforcement is a piece of this. And, you know, I've been an author of a bill that helps. Federalism has many virtues in terms of empowerment, but it also has some challenges. You have seams. You have, you know, areas where individuals can take advantage of that seam between a federal, a state, a county, and local enforcement efforts. And so, you know, one of my counties had reached out early on, years ago, to get nominated for the regrettable but necessary place to be in a high-density trafficking area, which makes them access funds, federal funds. And so working together in a bipartisan way, and Senator Schumer was certainly helpful, we increased the funding in this account and then ultimately got parts of my district designated to receive this money. And then, as was mentioned by Fran, enforcement is not just the narco traffickers, but it's also taking a look at how we administer, how we convey prescription drugs. And I know the state has taken some action on that, and it has been helpful in many ways. We also have seen some second-order impacts of that well-meaning legislation in terms of individuals who may have been taking painkillers 3 to 4 years, and then all of a sudden not having access to that and end up on the street, maybe buying a $40 pill, and then a pusher, bringing a $6 bag. So, we're dealing with those consequences too. And then finally, treatment. So prevention, education, enforcement, and then treatment. What I have seen on the treatment side of it is I think these programs, all of them are well-meaning, but some are doing better than others. I think that anytime we have a inpatient treatment program that's not at least 28 days, we're having a really low success rate with that. And I think what goes hand in glove with that is some of the insurance company coverages. So I would say that's where we've got to focus. I'm really asking for some help on this. We did pass one of the bills that looks at this. We need to do a good scrub of our programs and take a look at best practices and also things that are just not hitting the mark. I hope we move towards some uniformity in terms of what the requirements are for treatment programs, and then we nest that with insurance company coverage. I think that would help us to get to a better place, and I think it would probably make your lives, I know that you carry every day the frustrations of programs that aren't completely hitting our goals. So I just want to thank you for being here today, and I appreciate this opportunity. And now it's my privilege to introduce to you our host for today, Paul Tonko. He's a good friend and a colleague in the United States House. He's somebody who cares deeply about this issue and reached out to the White House and brought us all here together today. It's my privilege to introduce you, Paul Tonko.
Thank you, Congressman. Thank you, Chris Gibson, a good friend and partner in the House of Representatives. And thank you, Chris, for adding your voice of advocacy on behalf of this tremendously impacting epidemic so that we can assist our neighbors and friends in this region and this state and this country, because it's an awesome task. I thank you all for joining in this effort today. Just your attendance makes a statement that there is this universal concern about the epidemic that we face. I know, like you, I am crushed every time I hear of another fatality. I'm crushed every time I talk to firefighters who will alert me to the fact that they lost another person. EMS groups that tell you about the tragic response that they had to witness. Far too many of our neighbors, our friends, family members are succumbing to this terrible epidemic. And it is no hyperbole to announce that we are in a crisis mode, a crisis that comes to this nation in a very hurtful way with the opioid epidemic. More than 47,000 have died of drug overdoses in 2014, a vast majority of which were opioid-related. It is a sign of the times when you drive along a major highway, and instead of billboards that advertise a fast food operation like McDonald's or Taco Bell, has now been displaced with billboard space dedicated to informing us about calling 911 in case of an opioid overdose. It is disturbing how quickly this has become the new normal. This crisis has affected our neighbors, it has affected our friends and families, and it has affected our communities. Last month, I had the opportunity to tour St. Peter's Addiction Recovery Center in neighboring Cohoes, where I talked with a number of people, clinicians, those providing services, those receiving services, and hearing from those who are in addiction, struggling with heroin addiction, and one individual whose story was extremely powerful, has been struggling with his addiction for almost 3 decades. When he tried to seek help for his disease, he was met with a closed door and a 7-month-long waiting list to get treatment because of outdated federal rules. These delays and denials are simply unacceptable, and we can, and I believe we must, do better. In the midst of this epidemic, it is unconscionable that Congress has yet to deliver a full response worthy of the scale of this impending crisis. As the Vice Co-Chair of the Addiction, Treatment, and Recovery Caucus in the House, and a member of the House Energy and Commerce Committee, which holds jurisdiction over public health issues, I've been an outspoken advocate for policies and resources that will help us turn the tide on addressing this opioid epidemic, including a bill that I've co-authored with a Republican colleague that recently passed the House to raise the patient caps on doctors responsibly prescribing medication-assisted treatments for opioid use disorder, and expanding prescribing privileges to nurse practitioners and physician assistants. Now, when we introduce a bill like that, the programmatic policy approach and improvement is certainly welcome news. But my friends, I would say we need to accompany that. It's essential to accompany it with resources. I don't want to hear about the games that we can play about robbing Peter to pay Paul, or fungibly addressing it by sliding over dollars from the opioid or from the impact on emergency services for local communities. The Ebola crisis, while it's still in a crisis format, sliding it over and again playing games with people's lives. That is not going to be the answer. Or to be suggesting that we can harvest low-hanging fruit when we know that that resource has already been plucked from the vine. Let's be real. You know, I've sat through many bits of testimony in the caucus. It's a bipartisan caucus. It is heart-wrenching to hear these family members talk about their loved ones that have been lost. You hear the message. They don't want any other family to go through that walk. And so when we respond to that given concern, to that appeal, that heart-wrenching appeal, it must be done in earnest. It must be a genuine, academic, for real resource that we label for this programmatic response. Nothing else will satisfy. So, no smoke and mirrors. We have the professionalism, we have the volunteerism, we have the intellectual capacity as a nation to turn this crisis around. Through my work on these issues in Congress, I've come to learn that the addiction and the recovery community has no greater champion in Washington, no greater, than the director of the Office of National Drug Control Policy, that being Michael Botticelli. Since joining the Control Policy Office in 2012 and becoming its director in 2015, Director Botticelli has brought a fresh, a welcome, and much-needed perspective to developing our nation's drug policy. As a former state substance abuse director in Massachusetts, Director Botticelli knows that a public health-oriented approach that embraces the full spectrum of prevention, of intervention, of treatment, and yes, of recovery services is critical to reducing the impact that substance use can have on individuals, on families, and on communities. With Director Botticelli's leadership, the Obama administration, President's administration, has made tackling the challenge of opioid abuse a top priority, and I'm honored to be an ally in that effort. I'm honored to be in his company today. I'm flattered for this region that he has come here to provide for this very important program. Most importantly, Director Botticelli is a native of the Capital Region and a graduate of Siena College. So this visit represents something of a homecoming for him. So I think I speak for everyone in the Capital Region and upstate New York in expressing our hometown pride in the excellent job that the director has done in his time at the Office of National Drug Control Policy. So without further ado, I would ask that you welcome home and welcome heartily Director Botticelli for convening this forum and invite him to kick off this event. Director Botticelli, we love you.
Good afternoon, everybody. So first of all, I want to thank Congressman Tonko for that introduction. And, I do feel a doubly important sense of responsibility in coming to Albany, not only in terms of how we work together to end this epidemic, but particularly understanding the impact this has had on my region. And everybody that we have here. And it's not just the Capital District, it's all over this country. So I feel a tremendous sense of responsibility. And I also feel a tremendous sense of responsibility because my eldest brother, John, and his wife are here. And so if you grew up in an Italian family, you know that the eldest brother was like the honored son. So I feel a tremendous responsibility to make him proud in terms of the work that we do. So I also want to thank Congressman Gibson for being here today and for his leadership, and for all the electeds, for mayor, for the assembly folks who are here, because this is where the solution lies to this problem. We have a responsibility at the federal level to do really important work, but fundamentally, if what we do doesn't work at the state and local level, that is really ineffective. So part of the reason that we're here today is to not only hear how communities are coming together to deal with this, but what more we can do at the federal level to respond to this epidemic. As Congressman Tonko talked about, in 2014 we lost 47,000 people. Think about that, 47,000 people, and 28,000 of those were from opioid epidemic. And the magnitude and the humanity of this epidemic is really astounding. And I have been doing this work for almost 25 years, and I've yet to meet a family that hasn't been impacted by addiction and really hasn't been profoundly impacted by this epidemic. So as the director of the National Drug Control Policy, I'm charged with developing and implementing President Obama's drug policy strategy. And this administration is pursuing a balanced public health and public safety approach to reducing drug use and its consequences. And he clearly has made this a top priority and has spoken out on this issue many, many times. As Congressman Tonko talked about, he has called on Congress to pass $1.1 billion in new funding for prevention, treatment, and recovery support in his budget. And he wants to make sure that every American who needs treatment can get it. People should not have to wait 7 months for addiction treatment. Can you imagine if someone had a heart attack? And we said, wait 7 months until you can get care. We don't do that with any other disease, and we shouldn't be doing that with people with addictive disorders. And to reach that goal, we must also make sure that we have enough treatment providers and facilities, and that this funding would support placing treatment providers in communities that are most in need and would continue to develop effective treatment programs. So his budget proposal builds on our efforts to date to expand evidence-based prevention programs, increase access to the opiate overdose reversal drug naloxone, improve prescribing practices for pain medication, support targeted enforcement activities, and expand access to treatment. So recently, the U.S. House voted on a package of bills to address the opioid epidemic, and we welcome their support and their leadership on this issue. But we know fundamentally, and as Congressman Tonko talked about, fundamentally it will be inadequate if we don't provide funding particularly for treatment. If there was any doubt about the urgent need for funding, new preliminary data released yesterday show that the overall death rate in the United States rose in 2015 for the first time in 10 years. The overall death rate. Drug overdose deaths are playing a leading role and are continuing to be on the rise. In 2014, we lost 129 people every single day to a drug overdose. And for the first half of 2015, these data suggest that we lost 140 people every day. We need Congress to provide new resources to expand access to treatment to everyone who needs it and to move our country out of crisis and into recovery. And we need them to do it now. I want to thank them for their leadership on this issue and for pushing Congress to address this important epidemic. But we're here today to talk about solutions. Here's what we already know. We know that preventing drug use from ever beginning is the most effective way to reduce overdose deaths. We also know that treatment is the key to long-term recovery, and medication-assisted treatment is underutilized in many places, but is a critical tool to help people get and sustain long-term recovery. And that's why local efforts are so important. And I really want to recognize New York's leadership in addressing the opioid epidemic head-on. Expanding access to naloxone, including equipping and training law enforcement officers. establishing Good Samaritan laws that encourage people to call 911 to help an overdose victim without fear of arrest, for enhancing the state's prescription drug monitoring program to help identify patients at risk for overdose and for developing an opioid use disorder, and for allowing syringe service programs to help guide people to treatment and prevent the spread of bloodborne diseases. Governor Cuomo has recently launched a heroin task force and is being led by two people who spoke a few moments ago. The Lieutenant Governor and my dear friend Arlene Gonzalez-Sanchez, the Commissioner of New York's Office of Alcoholism and Substance Abuse Services. Thank you both for your leadership and for your partnership on this important issue. I also want to thank Greg Dewey, who's the president of the University of Albany's College of Pharmacy and Health Services, for being one of 96 pharmacy schools to recently join President Obama's call to educate pharmacy students about life-saving overdose medications. Thank you, President Dewey. The steps New York and the University of Albany are taking show how state and local leadership can make a difference. Solving this problem is going to take collaboration among federal, state, and local governments by every member of our community, including both public safety and public health agencies, to find what works best for each area. So with that, I think we have a great discussion today, and I'll ask our panelists to come in and join us. So I'll introduce them as they're coming in, and then we'll start a conversation. With us today, we have Chief Deputy Kerry Thompson from the Albany County Sheriff's Department. Davia Collington is from the Troy Drug-Free Coalition, Community Coalition. Dr. Dolores Simony, who's a licensed psychologist and adjunct clinical professor for counseling and psychological services at the University of Albany. Amanda Spiegler, who's a young person in recovery. And Kate Gruley, who is a parent advocate. So please welcome them all. So this is the fun part. Now the talking heads are over with, and we get to. So I'm just going to go down the line here and ask each of you to start. You know, we talk about the various dimensions of this epidemic, and it's been the impact on public safety, on public health, on parents, but also that we have solutions that work in terms of prevention, treatment, and recovery. You guys actually form a nice line there in terms of the continuum here. So I'm just going to ask you to spend a couple minutes just talking about the impact of this epidemic has had on you and the community, and a couple things that you're doing to address it, and then we'll have a facilitated conversation.
Okay, well, my name is Kerry Thompson. I'm a Chief Deputy with the Albany County Sheriff's Office. I've had about 25 years in law enforcement, and over the course of that 25 years, there's been quite a change in the way we have addressed the drug problem. We used to just arrest everybody and think that was the end all, but it's not. And obviously, we got it wrong. So there's not a day that goes by that my sheriff, Craig Apple, doesn't tell us that we're not going to arrest our way out of this epidemic. We're just not. So we've developed a few different things, and we've got the three-prong approach in Albany County, which basically is enforcement, which we target some. In Albany County, we're targeting the high-level and medium-level drug distributors. Obviously, in the course of our business, we're going to come across a lot of the low-hanging fruit, as you say, and we arrest them as well. But we're really focusing our efforts towards the high-level and mid-level to try to cut off that supply chain. The second is the education. We have a mobile education center that we go around to all the community events, and we bring young people in recovery. And we speak about it's basically a city bus that was transformed into a classroom, and it goes through the different stages, starting off with cigarettes and alcohol, and then progressing through the marijuana, the pills, and to the heroin and the opiates and the harder drugs. And then at the very back of that bus is a jail cell. So we have that we go around. We hit all the community events, all the health classes, schools, anywhere. It's a regional approach because we know this isn't something that stops at a county line. So we go all over the area, our area, with this bus and teach whoever will listen. And the last is treatment. And the last prong of our approach is treatment. And that we brought Addictions Care Center of Albany into our correctional facility, and we've started treatment at that level, and then we have medication assisted through our SHARP program, where when they get discharged, they get Vivitrol. I won't take up any more time because I know that we have more to talk about, but that's basically what we're doing now.
Good afternoon. I'm Kate Gruley. I'm here to represent Parent. I'm a proud mother of 2 children who are in recovery. Thank you very much. Thank you. You know, as a parent, you always think you can protect your children and that you have control in their lives, and doesn't always work out the way you think. And it's a devastating experience, just as it would be to find out your child had cancer or any other kind of disease. You want to protect them, and you want to do everything you can do to keep them safe. And it's been a rough road. It's been a long road, starting out when they were young, self-medicating, it starts out, you know, adolescents drinking, that sort of thing, and it just progressed, and unfortunately it affected both my children, and prescription drugs, heroin, and by the time my oldest was 21, he was entering his first treatment center, and now he's 28, and he's in recovery, and his 26-year-old sister has been supporting him and helping him, and she's been doing fabulous. She's been in recovery for over a year, and she convinced him to relocate, and is his biggest cheerleader and confidant, and I'm just so proud of my children. But you know, addiction is a family disease. I started off in 1996 moving my family up from Long Island, my husband and I, moving them to the country, and thinking they were going to have this healthy, safe place, but there, you know, we can find addiction anywhere, and it's the stigma. There's so many elements, and I'm so grateful to be here and to see the changes that have come. This has been going on for a long time, our struggle, and I am just grateful that so many people now are working together to make these changes, and I thank you all.
Hello, my name is Davia Collington. I am a community prevention specialist for Rensselaer County Department of Mental Health, and I coordinate the Troy Drug-Free Community Coalition. I'm here to talk to you about community coalition building. So community prevention is about working with the individual and the environment the individual is in. So for a visual, you know, you have a sick fish swimming in the pond. You take the fish out, you support them, and you know, provide treatment. But before you put that fish back in the pond, you have to clean out that pond because you don't want to put them back in there. So what community prevention does is, you know, convene people to really look at what's going on in the community and look at those things that are making it more likely for young people to start using substances. The coalition focus is young people, 12 to 17. Those are the ages we're really looking at now, right? So, you know, what we do is, you know, how do we do that? How do we clean that pond? Like I said, we're a convener. We pull various sectors of the community together. We identify what the problem is. We create, implement, and develop an action plan to address that problem. So what we're doing in Troy, you know, we know that in Rensselaer County there have been some deaths for some overdoses. So what we've done as a coalition is we've worked with the police department to coordinate the DEA's prescription drug take-back days. So far, we've gotten over 1,000 pounds of prescription drugs off of the streets. So, you know, we're really excited about that they're not out on the streets. And we're looking at possibly getting a drop box in the city of Troy to make it easier for people to, when they're not using those prescription drugs, to have a place to take them and not wait once a year for the Take Back Day. We work with the schools and the communities, the student assistance counselors in the schools to provide evidence-based programming to give young people the skills they need, those refusal skills they need, not to start in the first place. And you know, that's what prevention is all about, to provide young people with the opportunity to meet their full potential. Some other things we're doing is we did some community forums and educational sessions on addiction, and talk to parents about what to look for, how to talk to young people. How do you do that? Because parents need support too. I mean, it's easy to say, you should have done this and you should have done that, but parents need support too. So we provide some evidence-based programming to help parents. And some other things, we pull the young people together. Young people are really looking for a venue to have a voice. They're looking for a space to say, it's okay to be drug-free. We can have a good time and not be and not do drugs. So they're looking for that kind of space to happen, because society is telling them, in order to have a good time, you gotta do, use some kind of substance. So, or in order to deal with the pain that you're dealing with, you gotta take some kind of substance. So, we provide, we're providing venues and training young people on how to talk to their peers. So we know in prevention that, every day, 4,000 12 to 17-year-olds is trying a substance for the first time. What we're doing in community prevention is we're saying that is unacceptable. That is simply unacceptable. Let us come together as a community and protect our young people.
Doctor?
Good afternoon. I'm Dolores Cimini, and I am a licensed psychologist at the University at Albany, Counseling and Psychological Services. I was born in my career as a scientist practitioner, and that is that I learned to learn about science, and I learned to apply and even develop science around alcohol and substance abuse. That's the technical part. But the challenge that we face in working in colleges and universities is how to translate that science and bring it to the hands of our communities. And that's what I see as my mission. Why? Well, college students are coming to school with more and more complex issues: alcohol abuse, marijuana abuse, non-medical prescription drug use, opioid use, heroin use, and let's add in mental health concerns, depression and anxiety and risk for suicide. And I'm sure I don't have to tell all of you about the important link that there is between substance use and mental health concerns and risk for suicide. That's why this is so important to me. In addition to that, I think, too, in working in the House of Higher Education, which is where I am, that we need, as professionals, to be committed to have the conviction to make some promises to our students, to support their success, to help them stay in school, and to help them graduate and be productive citizens in our society. So what is it that what we can do? 4 things, in my opinion. Number 1, support health. Number 2, give our college students a home. Number 3, give them a purpose. And number 4, support communities. So what do I mean? In terms of supporting health, what we need to do in colleges and universities is to provide informed health care to our students in recovery and to our students who are facing addiction and high-risk alcohol and drug misuse. Doctors, psychologists should be very conversant with alcohol, substance abuse issues and concerns. Screening and brief intervention and referral to treatment. We live by that at the University at Albany Counseling Center, and I'm proud to say that every student in every psychology program at our university is going to be leaving their programs knowing how to do SBIRT. In addition to that, with the support of SAMHSA, by the way, in addition to that, we need to build connections with our community alcohol substance abuse agencies. Second, home. On college and university campuses across the nation, we see what we call living learning communities. They're typically built around majors, like at our university, the world of psychology, the world of accounting. How about the world of collegiate recovery? To build college and university living, learning communities based on therapeutic communities that are outside campuses, to have faculty have lunch with students, to have seminars, to have 12-step groups, to have counseling and health services support these groups, and to have these ILLs self-governing by our own students in recovery. So that's what I mean by home. Purpose. Well, that's the essence of academia. To support our students in continuing their work toward their degrees if they wish to support them through all of our agencies, academic advising, career services, counseling and psychological services, our faculty, our staff and student affairs, to help them be aware of our students in recovery and support their purpose. We have a program that's been operating since 1970, a peer-to-peer program called Middle Earth, where our students in recovery work beside our students who are not in recovery. They operate a hotline service. They run a peer education program. Some work in career services. They earn course credits across the board. And I'm happy to say that the State Department of Education actually approved our courses for a new major on campus, a BS degree in human development. So our students in recovery and our students who are doing peer-to-peer service can actually earn a degree now, a college degree. So purpose, community. That is teaching our students in recovery to be empowered, to help each other and to help themselves, and to tell their stories on campus and in the community. Here's my story. Here's what I'm struggling with. Will you sign on and support me? And so that way, we are building assets. We're building community one person at a time. And I think what I will do is stop here. Tons of ideas. I need to stop, right? Okay, thank you.
So before we go on, I neglected, I was very rude in not introducing our adjunct panelist, Savannah, who's helping us out. Good, Amanda?
All right. My name is Amanda Spiegler, and I am a young person in recovery. This year, actually, in about a week and a half, I celebrate 2 years clean. Thank you, thank you. You know, the past 2 years of my life have really been a whirlwind. I fell into drugs and alcohol when I was about 17. You know, classic love story. I met a girl and she, you know, lived this lifestyle, and I was so enticed by this lifestyle that I, you know, had to join in. And I had no idea what I was getting myself into. I went to my first rehab when I was 18, have been to 10 different rehabs, 2 detoxes, 12 other institutions. I mean, I've been in and out for the past 6 to 8 years, and it's really, it's been a ride. And one of the things I will say that I've been most fortunate with is having that support. This year, a few weeks ago, actually, I graduated with my bachelor's in psychology. Thanks. And I am starting my master's program in mental health counseling and currently working on obtaining my CASAC. And the person I was 2 years ago would never have been able to accomplish those things. And it took a traumatic event for myself. I ended up being incarcerated. My parents pressed charges against me. And being mandated to treatment was the only way that I actually entered. I went away to rehab for 10 months, and it was one of the most difficult things I ever could have done. And I am so grateful for that experience today. I've been, afforded the opportunity to complete school, to complete my degree. I've been afforded the opportunity to work with Dr. Chimini and, other groups in the community as an advocate for, recovery programs and people in recovery. I currently have a job with a non-for-profit working with adolescents, at-risk adolescents, and everything that I have today is because of, the many supports that I had and the many programs. I was involved in an alternative to incarceration program. I'm currently involved with, community outreach and at-risk children. I work with Dr. Chimini within the counseling center at UAlbany. And I'm very, very fortunate today that these different programs exist. And not everyone is as lucky as I am. And not everybody makes it. And I think that is the hardest thing, especially, as a young person in recovery, I am an oddity. Most people don't get it at my age. And unfortunately, they overdose. And these things happen on a regular basis. And really just, I don't even know where I was going with that quite. Just, it's really important, I think, just that these programs exist. I know I'm grateful for them. I know I have other recovering people in my life who are very grateful for them. And I just, my work is, kind of in the effort to keep these things moving forward.
Thank you all for your comments, and I'm going to ask a couple of you mentioned, and Kate, I'm going to start with you. You talked about something that I hear from lots of parents, lots of people who struggle with this issue, and that's the role that stigma plays. And we know that stigma keeps people from asking for help and seeking care. And so maybe you could talk a little bit about your experience and some things you think, and then Doc or Amanda, if you have some thoughts on how do we overcome this issue of stigma. This is such a disease that is still in the shadows and it's still silenced. I think we're changing that, but maybe you could talk a little bit about your experience.
Yeah, absolutely. The stigma, there's a shame, the guilt as a parent, how did this happen? What did I do wrong? But even when you get over that, and there is, let me give a perfect example. I have been to the emergency room many times with both my children, numerous emergency rooms. And although, they've had good help many times, but there is not one time that we've gone into an emergency room where my children have been left on the gurney in the hallway, where they ask you questions about your name, your age, when's the last time you used the drugs, what's your social security number, all of those things. And everybody else who's in that hallway is being asked the same questions, are also people there for alcoholism or some sort of substance use disorder, looking for treatment, looking to go to detox. And I can tell you how many times I've sat on that gurney with one of my children for hours because they have to wait till they get into the detox, and it's wonderful that they were able to, but there's no chair offered. there's no drink of water, no compassion. And this is in the medical community, and not just one hospital, but in many hospitals. And in 8 years, it's happened multiple times. And I have become more vocal about it as a parent, and I used to be a public school teacher for 20 years, and I was a prevention educator, and so I've been involved more in the community. So people contact me. But it's so hush-hush. I had a woman call me last week and said, there's somebody who you know whose daughter is having some problems, and could they contact you? But there was no names exchanged. It's like, of course they could, but there's that shame, that embarrassment that's going along with it. And sadly, I think that holds us back. I think it holds people who need treatment, people that are in recovery. It prevents them from really fully recovering. My family, I can say, I think my children sometimes are the worst ones about it. They're probably not happy I'm saying this right now, guys. They're embarrassed. They don't look at it as it's a disease. I'll say it to them, but sometimes they're their hardest critics.
Good. Thank you. Amanda, you're one of a growing number of young people in recovery who talk about, in a very open way, your struggles. And I wonder if you can reflect on how your personal voice can help some of the stigma issues that we're talking about here.
Absolutely. And I agree there's a lot of stigma, and I think with stigma we also have to talk about stereotypes. And who do we consider to be the typical drug addicts, and who are the drug addicts who are worth treating, and who are those who are not. I think for myself, putting myself out there and sharing my story, which I am more than happy to do, I think we need more of that. I think we need more people standing up and saying, this is a disease, this isn't a choice, this is a problem that's affecting our nation. It's not affecting one or two people, it's not affecting a group of people, it is affecting an entire country. And it's very, I find myself sometimes taking a step back and wondering how much should I say, whether I'm at work or I'm at school or I'm just speaking with a random person, because what will they think? And then I have to remind myself, especially being in recovery, does it matter so much what they think if I can share something that could be helpful, whether it's for that person in particular or something they can pass on? I don't think there's a single person, who, there are not many people who don't know somebody who isn't impacted by this disease. I had the same problem as, getting clean. It was not an accomplishment. It was not overcoming something. This wasn't a disease. This was a choice. And, why should I be proud of my sobriety when I shouldn't have gotten into this to begin with? And, that was my own reflection on myself, but it's also a very societal reflection. And I think that putting that message out there that, this is a disease, that recovery is difficult and it's an accomplishment. There are more ways of kind of getting the word out there that there are people in recovery, that there are people who will help you, that, even that there are, programs and outlets that aren't just AA and NA, which are excellent and tremendously helpful outlets, but there are different things available, and really just breaking that down for people, because I feel like if we as a community and as a society can approach this with a more kind of medical stance of this is a disease, and someone who is in remission for cancer will gladly applaud, but someone who's in recovery, it's much more difficult to get that applause or get people to recognize just how difficult that is and what a hardship it is.
Good, thank you. So Chief, I want to follow up on something that you talked about, and I think you represent many sheriff departments and local law enforcement who I think have really remarkably changed their approach to how they deal with people with addictive disorders. Certainly law enforcement has a huge role to play in keeping our communities safe from dealers and keeping drugs, but understanding that we also need to be partners with public health and with treatment programs. So I wonder if you could, was that a hard shift to make within a law enforcement agency, or how do you think, what precipitated that change?
I mean, it was a hard shift, I believe. Like Amanda said, that stigma exists. Everybody's attitude was that, you know, that these are just drug dealers or drug users. They're not sick. They made that choice. So they're not the same as a cancer patient or someone else that's sick. But once we started teaching our people, and they began to realize that this is a valid approach to the problem that we had. I mean, bringing, you know, Albany Police Department, they have the LEAD program. This is a nationwide shift in our profession. That is, you know, the idea that, you know, there's other options out there in order to address the problem. You can't lock them up, throw away the key. You have, for example, our SHARP program. We have a SHARP program that we brought in outside providers, treatment providers, into our correctional setting, where the inmates who voluntarily participate are given the opportunity to exist and coexist on a tier with peers with the same problems, the same troubles they have. We brought the outside provider in to run group sessions. They run group sessions twice a day. They live in this community setting. They feed off each other. They have the group sessions, and then they have one-on-ones when necessary with the counselors. From that point on, as they progress through, they have an exit plan, which includes mental health. We work very closely with the mental health profession in Albany County. So we try to address all those underlying issues, and then at the end of that stay, if they want to participate, we offer a medicated assistant treatment, which is Vivitrol, where they can get that shot, go out to the outside, and stay clean for 30 days, at least 30 days, while they get their treatment and get on the path of that. And another aspect of that is Sheriff Apple's worked with some of the larger employers in the county where they can get valid employment after that. So it's a progression right straight through our correctional facility where they come in, they have to detox right away. They don't want to talk to anybody. They don't want to be involved with any treatment. They don't want to hear that. And they certainly don't want to hear a cop telling them they need treatment. So they come through this.
They might listen.
Most generally, they don't want to hear anything from anybody when they're in that condition. But once they detox and they realize that there's an opportunity there that exists for them to get better, and then they see through the whole thing that there's a light at the end of the tunnel where they can get a good job and they can have a family and they can exist. They can be a good member of society. It's just they got to get to that point. And we're bringing these people back into the facility that are success stories, that have done well in the program, and teaching the inmates that are in there that, you know, this can happen to you. You just got to want it and work hard, and you can have a life after this. You don't have to go back out to using, stealing. Nobody goes to a guidance counselor when they're in high school and say, I want to be a drug addict. I want to be a prostitute. I want to be a thief. But that is all a result of their choices that they made and some bad decisions along the way.
Good, thank you. Thank you very much. You know, one of the things that you talked about that has been an important initiative for us is the use of medications to treat people with opioid addiction. We've seen time and time again that they're very successful. They have to be combined with other behavioral and recovery supports. And Doc, I'm going to pose this question to you. You said that part of your responsibility is to translate science into practice. Yet we haven't seen as much kind of embrace of medication-assisted recovery as we hope. And I wonder if you have thoughts about how we convince more physicians to prescribe these life-saving medications, or that we promote more use within jails and prisons. I wonder if you have thoughts from your work about how we can really change the mindset of people to show that, you know, being on medication as part of your recovery plan is no different from any other recovery.
Sure. Well, certainly the first step is training and dissemination, and that is getting the word out that medication-assisted treatment works. It helps keep people alive who have very, very serious illnesses, consequences of addiction, and another way to do it is to have doctors talk to doctors I've learned that in training on SBIRT, that if we wanted our health center to deliver SBIRT, we needed to bring in a physician. It really makes a difference to them. So the providers in the same disciplines who are champions of this issue are critical in providing the training. In addition to that, getting out to the public's information on the importance of medication-assisted treatment. So getting out journal articles for the scientists, getting out newspaper articles for people in the public, so then the public can say, well, you know, I would like medication assisted. It's like the medication commercials on TV, you know. Now patients are coming in and saying, I'd like to try this. So those are some suggestions. Thank you.
So in the correctional setting, when we educate the participants in the use of Vivitrol, but they're still skeptical. The first person that was going to take the Vivitrol shot, I went out and met with him just after he took it. And he says, you know, I thought you guys were full of it. He goes, I really didn't know what this was all about. I had in my mind that I'm gonna test it. When I left here, I'm gonna test this. I don't believe you guys. 3 days into the shot, he goes, I don't have any craving. I don't want to do it, and I have no desire to do it. So that's just one of the I mean, even teaching the user or the consumer, if you will, that isn't going to hurt you. They don't believe you. They're still skeptical, but there is that, you know, that success story there.
That's great. Good. I want to take some questions from the audience, and one is directed at both me and Congressman Tonko, so I'm going to put him on the spot. I know he can handle this one. And it's a question that we get all the time, and that's why I think it's important to raise it. And it says, our families are desperate for help and funding to expand access to treatment and recovery support. What must Congress and the legislature do? So I'll turn it over to you, and then I'll add some comments here as well.
Well, there was a package of bills that was developed recently in the House, and I know the Senate is working on a package. And individual states, New York is doing a tremendous job in attempting to respond. But first, I think, as the voices of those legislative voices representing great masses of the population need to set a tone. Until we recognize addiction as an illness, we're not putting it in the proper realm. And so I think it's important for us to repeatedly message that we're addressing a public health crisis, that an illness is overwhelming us, and the illness of addiction needs to be addressed. Then it's programmatically putting together the policy formats that will best respond in terms of services and attention that we need to pay to prevention, to treatment, to recovery, to employment, as the deputy indicated. There has to be light at the end of the tunnel. I would think that's part. I can't speak from experience, but I'm listening intently to everyone. So we need to provide that sort of reinforcement, perhaps avoiding the issue, and then if you fall, if you have the impact of addiction, then there has to be those elements of success that are part of the equation. None can be skipped. But finally, it's just window dressing if we acknowledge through a sense of Congress that this is an epidemic, that this is a health crisis, this is an urgency. And if we don't provide the resources, we're providing false hope, which I think is a painful outcome that should embarrass all of us. What I heard here this afternoon was, and I think, Director, you said it in the press conference, this has to be a community response. The intellect that we have through professional response and volunteer response is a powerhouse for us. But it also has to be the parent and the family reinforcement, the law enforcement community, doing those innovative things as you're seeing here in Albany County and in the city of Albany, where, incarceration isn't that first step. It's connecting to the individual and making certain that recovery and providing a steady ground beneath your feet and offering perhaps employment. But what I would answer most vehemently in this question is be there, ready to put my ideas on the line for resources. We live in the most abundant society in the world. We're dealing with 80% of the illicit drugs being consumed by us, 4.7% of the world population, consuming 80% of the world's illicit drugs. That tells me we have to do something. A budget is our series of priorities, our wish list. This needs to be high on the wish list. It's affecting our neighbors. I lost a neighbor last June. You lose neighbors, family members, friends. We've had people torturously tell us what's happened. So this is an urgent request that requires the resources. And, you know, I heard it in 2010, 2012, 2014, and I'm going to hear it in 2016 in the campaign. We need to come to the revenue table and visit tax policy. Well, yes, we do. And let's do it. Let's decide what our budget needs are, create the revenues that are required. And this idea that we can hold the line forever on revenues, take a pledge forever to hold the line on revenues, do it in our own families first. And then maybe we'll follow. We need to have the resources there and do it in progressive format and raise those revenues and not rob from Peter to pay Paul. Don't take from the Ebola crisis to help the Zika crisis, to help the drug epidemic crisis. It's all a shell game that's not solving the problems. Not solving the problems. So be upfront.
So I'll take a little liberty here. The other way that you can be helpful too is that, Congressman Tonko doesn't need convincing that we need more resources. But there are other members of Congress that do need to hear from their constituents on, I have to be careful because I can't tell you what to do or what to lobby for. But I can tell you to make your voices known. And that if constituents, if folks in Congress hear from you as community members that this is an important and urgent need from your standpoint, it goes higher on the list. And so, having a grassroots conversation and letting your voices known with your representatives, both not only here in the state, you've got state leaders all in on this, and that's because parents like Kate have made their voices known. And so you have the opportunity to do that. So whatever you can do to assist folks like Congressman Tonko in doing that. This question, I think, is a really important question. It says, can you talk about the need for local recovery organizations and recovery community centers? And if you don't mind, I'll take a little license and then do this. So I think most folks know, and I've been pretty public about the fact that I've been in recovery for quite a while now, more years than I care to admit. But one of the things that I can tell you is that there are many people, and I'll speak for myself, when you know that you need help, you know you need to stop. That part of what kept me is not seeing a life on the other side of addiction. And I remember thinking to myself, if I stop drinking, my life is going to be over. I am going to have one of the most boring existences that I'm ever going to have, and nothing could be further from the truth. And I didn't see this vibrant recovery community on the other side of that. And I think this movement now toward recovery organizations have become really important to not only help people get jobs, go back to school, get housing, but also to show people that there's hope. And so it's really important. And, with your kids, or Amanda, if you could kind of talk about the importance of that kind of recovery community in giving people hope, but also giving a place for people to go after treatment. This is a chronic illness, and people need lifelong help. So I wonder if you have some thoughts on that.
Definitely. I think, community support is a tremendous part of recovery. It's something, they tell you in treatment, you can't do this on your own, and it's so true. And I feel that there are so many resources out there, and I learn about them all the time. But I'm learning about them because I'm making my way into the field. And I didn't know about them as a person struggling with addiction. things like young people in recovery, things like friends of recovery, and there are so many others that I can't think of at the moment. These communities of people in recovery who bond and like promote wellness for one another, they're so important. I know for myself, it seemed like for a long time I would just watch my friends go in and out the same way that I was. And it wasn't until fairly recently that I found a really great group of sober support. And you do need that as well. You know, as a recovering person, I need other recovering people in my life who know what I'm going through, who know the struggles that I deal with, who understand that, you know, 2 years clean, I still want to get high sometimes, but I'm not going to, because I have those people in my life, because I have those resources, because I have, you know, places to go and people to reach out to. And it really is just, I can't emphasize enough the importance of just having someone to fall back on. You know, like yourself, when I was getting high, I did not see any light at the end of the tunnel. I was always a very motivated person, and I kept trying to go back to school, and I dropped out of school twice, and then I got expelled. I would try to get a job, and I couldn't hold a job for more than 6 months. I would try to get clean, and I couldn't stay clean for 30 days, and it just felt like an endless cycle. And this time around, the big difference was relocating and going to rehab for 10 months, because that just kind of got me out of that environment. But once I was placed back into society, I was introduced to all these different support systems, and you know, it was sober housing, and it was the NA and the AA community, and it was young people in recovery, and I suddenly saw that like there were all these people who were just like me, who went through the things that I went through, who felt the same feelings that I felt, and they made it to the other side. For me, that's a big part of the reason why I'm going into the field, because I, you know, would like to think that I can be that person for someone, saying there is another side. And it just, it's so, I don't know, I keep going back to the word grateful, but I'm just so grateful that like I was able to have that experience, and I, you know, hope that we can kind of promote these programs more and get the word out there that, you know, there is a place to go and there is hope for the future.
Great. Thank you. Very well said. So unfortunately, we have to wrap up, but I promised Kate that I wouldn't leave without giving everybody an opportunity, and in all seriousness, to give me, Congressman Tonko, some recommendations about what great things are happening both here in Albany and in the state, but more, we all know more needs to be done. So I want to give you an opportunity to say one or two things, Kate. She gave me the list. No, but so please start, and then I'll ask others to just to say, you know, what more should we be doing at the federal level that can help you as a parent, as a sheriff, as, you know, prevention. So from your own perspective, what do you think would really help at the federal level?
Well, thankfully, some of the points I had on my list were taken care of already. But one thing we really haven't talked about is supports for family. You know, I had some of the skills and resources to, you know, I took time off of my teaching job and went to school to be a CASAC. I mean, you know, I kind of got really into it, and then became a prevention educator, and now I'm getting ready to work for Project SafePoint in harm reduction. So that was just kind of the way I dealt with it. But there weren't a lot of opportunities for me otherwise, and because as Ben said, being in the field, I've gotten to meet people and learned about more resources that are available. Parents need help. Families need help. They don't know what to do. And the stigma, as I said, is keeping them from asking for help. But even when they ask for it, there aren't a lot of resources. Thank goodness for Oasis. There's more available. You know, there's their website. They can find out about treatment. But it's an effort. And one other thing on my list that goes along with any of these things we've talked about today. I work in Albany, but I live in a rural area. And if you live in a rural area, any services that are hard to get here are impossible to get there. I mean, if you don't have a car, because you don't have public transportation, you don't have Wi-Fi, and you don't have I don't have cell service in half the places I live when I'm there. I mean, there's so many resources that are available that people can't even use. So,
Okay. Deputy?
Well, I guess there's very few days that go by that we don't get a call from a parent that is struggling with getting their child into treatment, whether it be an insurance barrier or there's no beds available. I think that's what I would like you guys to take back. They're so frustrated. There was one parent that I talked to that his son was a honor student, captain of the football team. Had him ready to go to treatment. He wanted to go to treatment. Got him in the hospital. They pushed him away. And that child overdosed and died. So, I mean, that's how important it is. When you have them there, ready to, they make that commitment where they want help, and to be pushed away at that point, I think there's basically, they have no light at the end of the tunnel. So they just go back to where they were doing.
So this is not the first time this has happened. And I think it's important to point out that I just asked the chief deputy what he needed. And he didn't ask for more officers for a drug task force. He asked for more treatment resources. And this is actually what we're trying to do at the federal level, that our law enforcement folks we know play a key role. But we know that treatment has been underfunded for a long time. It's why people end up committing crimes, is because they don't have appropriate access to long-term care treatment. So thank you for saying that.
And I just want to add that don't forget about prevention. Prevention works. We really need to take care of our babies. You know, prevention works. Resources to provide positive alternatives and support the efforts in the prevention community. So.
Okay. Thank you very much. I think that's a really important message, because we were talking with some folks before, and that, you know, while a lot of the talk has been around prescription drugs and heroin, which are certainly serious, we forget the role that prevention can play, and really, you know, which starts people on a trajectory kind of down this road. So thank you for reminding us. Doctor?
I have.
She's going to ask me for more money.
Oh, no. No. I have two wishes, so to speak. We know that screening, brief intervention, and referral to treatment works. It catches potential addictions early. And so I have this wild idea. What is the biggest touch point for college students? That is academic advisors. Each college student across the nation probably has at least one contact with an academic advisor about a major, about courses. So how about modifying ESPERT, training advisors in coaching and motivational interviewing, and when they're asking about what courses do you want to take, how are you doing, teaching them about warning signs for addictions, warning signs for mental health concerns, and teaching them the referral skills. So that's one of my dreams. The other dream that I have, the wish that I would have, and let me start by saying, giving context, higher ed has lost a lot in terms of supports for technology transfer, getting evidence-based practices to the field, health education, psychology, social work, those that do prevention in colleges and universities. We've lost a lot. We've lost a higher education center. We've lost funding. I would wish for a center for excellence, a national center for excellence to be started that is a collaboration among federal agencies that work with young people, and particularly, well, those that are in college and those that are not. We know that young people between the ages of 17 and 24 are at highest risk for addiction, alcohol abuse, alcohol misuse, mental health concerns. So those are my two wishes. Thank you.
Thank you.
Okay, well, I too have a laundry list, but I'll give you the short version. So I think the first thing, I just want to re-emphasize the need for treatment centers. As I said before, I went in and out of rehabs and detoxes, and at times I was turned away from detoxes because I wasn't sick enough, or I didn't have enough, symptoms of a detox, or I was detoxing from the wrong drug. And it just, when you're ready to take that step, you're ready, and it took getting arrested for me to finally get treatment, and that is only because it was mandated. So it had to be paid for. My insurance company had to pay for 30 days in a short-term inpatient. It had to be paid for when I spent 10 months at a residential facility. And that was not the case. And, perhaps I wouldn't have gotten to the point of having been arrested if my insurance company hadn't kicked me out after 10 days. It's not long enough. You really have to remove people from their environment for a substantial amount of time in order for them to, even come to the conclusion that, there is a possibility to change. That's the first thing. The second thing is emphasizing that there is a strong correlation between mental health and substance abuse. Right now, a lot of programs are very separated. It's very hard to get someone into a substance abuse program because their mental health isn't treated, but mental health facilities don't want to treat them because they're using drugs or alcohol. And it's, so creating more of that, these dual diagnosis centers, or, encouraging the fields to kind of come together. And I'm sure this has to do with funding that I'm not aware of, but, allowing for funding that, that allows these two separate entities to work together. Yeah.
Thank you. So I really want to thank everybody today for, I think, your wisdom and your insight and your willingness to share your thoughts and ideas. I want to again thank Congressman Tonko for his invitation. He too is a passionate advocate for these issues, and it's very apparent to do that. And I want to thank all of you. While we have a responsibility, we all have a responsibility as community members to look out for each other and to look out for our community members. So thanks everybody for all the work that you do.